February 12, 2021. And on Tuesdays like this, you may have observed that we talk about COVID-19, as this edition of the program is sponsored by the Kaduna State Ministry of Health. My name is Iheanacho Prince, and today, looking at COVID-19, Nigeria has surpassed 100,000 cases as it is. It's almost going to be a year in a few weeks since the COVID-19 was recorded in Nigeria. The first case was recorded in Nigeria. And with that, we see stories, very, very disturbing numbers. And also we see that the federal government is crying out now. And not just the federal government, but hospitals as well, saying that they're running out of treatment space. If the numbers continue to rise, we may not have facilities to cater for people who come down with the virus and even other ailments, as the hospitals are almost filled to capacity across the country. There's also, speculations of another lockdown. We also may be seeing that schools may not resume on January 18, which was the date the federal government initially slated for the resumption of schools. If all of these is what we would have to deal with as a nation in 2021 as well, what is the way forward? How can we manage this? How can we come out of the woods? It seems like instead of coming out with the second wave, we're sinking deeper and deeper. But we, as resilient people that we are, would always find a way to come out of this. Discussing the situation, COVID-19 situation with us, especially in Kaduna State this morning, is Professor Clara Ejembi. Professor Clara, thank you so much for joining us this morning.
Good morning. How are you?
I'm very well, thank you very much. Now, looking at the situation, what's the update in Kaduna State, as regards COVID-19 and the state of health facilities in Kaduna?
As you rightly said, we see increasing number of cases of
or reopen schools as it is, but then the people who still go to the markets and people who still go to several other social gatherings, and those are places where the virus is said to be transmitted the most. If we have this situation and the numbers are rising like this, what can we do as a people? Even as we know, we do not want another lockdown. We don't want the economic hardship that comes with a lockdown. What do we need to begin to do more so that we can avert this impending danger?
Yeah, as you rightly said, the new variant is about 70% more transmissible than the one that came with the first wave. And obviously, the rising numbers we're seeing may in part be attributable to that. Even those reports from England and other countries say it may not be necessarily more severe, but because of its transmissibility, more people get infected. And the bottom line, and we keep saying it, the vaccine is not yet in Nigeria. The only vaccine that we have is behavioral vaccine. We need to modify our behaviors. We need to adhere to the protocols that have been put in place. People are flaunting it with abandon. They say wear face mask. The face mask is your shield, and that is the first line of protection. Because if people are wearing face masks, even if I'm infected, the virus is unlikely to at least leave me and get to other people, because it will be trapped in the face mask. So if you care about people wearing face mask, it protects you, it protects others. And if people are wearing face masks, and since it is a droplet infection, it will be trapped and it will not get out. But look around you, how many people are wearing face masks? They are not. and observe social distance. People are not doing that. Do respiratory hygiene. People are just misbehaving. Wash your hands, frequently, or use sanitizer. People are not doing it. Avoid crowds. That one safe. I see people are going to weddings. They are going to, you go to weddings, you see 1,000 people crowded in a place. You go to churches, mosques, people are not social distancing. You go to markets, they are crowded, and all of that. And I don't know whether you've read the story of in the past 2 weeks when about 5 professors died, and they all went to a wedding. The chairman of the wedding was a former vice chancellor of the University of Lagos. He died. One professor of criminology that was in ABU died. 3 other professors, they were all at that wedding. Avoid weddings, avoid crowds. People are just living lives as if there's no COVID-19. And of course, if you don't have any need, stay at home. This is not the time to socialize and go and visit everybody that you know in this world. Stay at home as much as possible. People are just flaunting everything. And if we are not ready to observe these very basic things, this thing will continue. So we need to take responsibility, and we need to begin to do the right things. This is, it's not something that is so difficult to do, and it's not depending on some technology or some drugs. Just modify your behavior appropriately, so that this one becomes for us the new normal. Reduce your social interactions, stay as much as possible at home. Whatever you can do remotely, do it. You don't have to go to, if you can do most of your office work at home, stay. If you can do your meetings on Zoom, do it, do it remotely. But I really don't know the mentality of the average Nigerian. They want people to go and force them. It's not everything that we can force. You will not carry your hands and go and put in water and wash it. So you have to invite these things, change your, adopt the correct attitude and do the right things. And if we do it, I bet you at least this thing will go down. To augment this thing, the government is trying to see whether they can get vaccines, which is another story, to protect.
Professor Ejembi, in December, around the second week of December, the state government, banned or closed all, or directed that all event centers be closed. We still see events and weddings holding in Kaduna State, and people, like you generally mentioned, people violating the protocols. Does it mean that people still do not believe or still, doubt that COVID-19 exists? Does it mean that people are not, do not care so much about their health and well-being that they still indulge or engage in all of these, contraventions?
I think up to now, we still have a sizable proportion of the population that still don't even believe in the existence of COVID-19. Then some people think they are invulnerable, so they perceive their risk of getting the disease to be low. And thirdly, I think there are also the cultural pressures. How can your child get married and you're not inviting people to come? So people then to cultural, socio-cultural norms to please people and flow with, the cultural expectations, as it were. But I know that during the period of lockdown, And this even when lockdown was being lifted. You're saying if you are doing gathering, it should not be more than 10 people, 50 people for the such events. So maybe we should go back, short of total lockdown, to begin to enforce these things. If you must marry, there shouldn't be more than 20 or 30 people. At least you can do that in your sitting room and go. And we should find, ways of enforcing some of these things. Internet clubs should close. And even in a neighborhood, when you come in the night, you can hardly find place to drive. The whole place is congested. People are, filling up the clubs and the lounges and whatever it is they claim they are doing. So maybe people should begin to go around in the night, and for the owners of such places that are violating, maybe they suspend their license till at least the COVID-19 is over. But there must be sanctions, and we must find means of enforcing some of these things.
All right. We're talking about the older demography, age demography, and how deadly or risky it can be for them to come down with the virus. Looking at the facilities that we have in Kaduna State, would you say that we have, we've reached an efficient level where we can manage, these severe cases and the numbers that we can manage at a time, looking at how the numbers are increasing, and we have older people who may be coming down with the virus? Can we effectively manage their cases? Looking at the equipment we have at the facilities, would that be able to manage them in Kaduna State?
The key things we require for the management of severe cases of COVID-19 is availability of oxygen. That's number one. And number two, having respirators or ventilators. I know that we've been having shortages of oxygen, and patients have had to be buying them. But government is working assiduously to see how this challenge can be overcome. So effort is being made, to source for oxygen and make it available. But the bottom line is, I think, setting up oxygen plants is not very expensive. So, and I doubt that it will cost more than 2 million. I'm not too sure, but from what I read. So I think that teaching hospitals and the state government should be able to set up oxygen plants, because quite a number of people have died because of non-availability of oxygen. A good example of that is one of our professors that died at Gwagwalada. He did not have oxygen. Friends were started running helter-skelter around the country, and before they mobilized the oxygen and brought, he had died. So oxygen is quite critical. Number two is the ventilators that are required. I think we are very short on ventilators, and obviously to be able to manage these severe cases, have ventilators, oxygen and whatever, we need to have intensive care units set up, properly equipped with competent, skilled doctors and nurses to be able to provide intensive care. Most of our isolation centers do not have intensive care units. I know Kaduna State is working assiduously to set up a standard facility in Mando that will have an intensive care unit. So we need to have intensive care units, we need to have respirators, we need to have adequate supply of oxygen, and we need to have skilled personnel that will deliver quality care. and we are short on all of this.
All right, Professor Clara Ejembi speaking to us on the state of COVID-19 in Kaduna State. We'll continue with the program right after this break. Please keep it with us.
Keep it locked. Your station. Thank you.
Yes, it's true. I'm not good at all. Welcome back to Perspectives on Invicta 98.9. Now, if you just joined us, we have been talking the COVID-19 situation in Kaduna State with Professor Clara Ejembi, who is a lecturer, Department of Community Medicine, Ahmadu Bello University, also community physician, Ahmadu Bello University Teaching Hospital. She is head of the surveillance pillar of the Kaduna State COVID-19 response. Professor, thank you for staying with us.
Thank you.
Right, getting back to the conversation now. We were talking earlier about the facilities that we have in Kaduna State and how they may not be properly equipped to manage some of these severe cases. Now, if we're looking at the milder cases as we see them, people do not really take COVID-19 serious because the symptoms that people present when they come down with the virus are similar to what we've always had, similar to the common cold and all. And so people don't take it serious. They don't get to test, so they don't even know that they have COVID-19. How can this, as it is, fuel the spread of COVID-19, especially at community level?
As you rightly said, more than 80% of the cases of COVID-19 are mild or asymptomatic. That means they don't even show any symptom, no fever, no cough, nothing. And this is quite dangerous because if you don't have symptoms or they are very mild, you are unlikely to even think that it is COVID-19. So you continue to live your life as normal, interacting with people, moving about, going about your business. And as you do that, you are spreading the virus. So because of this, the diagnosis may not be made and you will not go into isolation. And therefore, the mild or asymptomatic cases play a very significant role in the spread of the infection in our community. And that is why the government and the health sector is putting emphasis on testing of as many people as possible. It's just like HIV/AIDS. Majority of the people that are infected don't even know they are infected. And if you don't know you are infected, you keep moving about, living your life as normal and spreading the disease. So the only way we can reduce the spread is for people to get tested. So that's why Kaduna State governor, for example, has given marching orders to the health sector to at least ramp up testing in the state so that we can test at least what percentage of the population, at least 1% of the population within a given span of time. So we are talking of 10%, 10%. So we are talking about 1 million people within a given span. So we urge people, as many people as possible, to go and get tested. The testing is free, and once you are tested, if you are positive, at least you'll be isolated so that you will not continue to spread the infection to other people. So test, isolate, and treat. That is the only way at least you can deal with asymptomatic or mild infections in the community.
All right, test, and testing is free. I like the fact that you emphasize that testing is free because a lot of people may be worried that they would have to pay for testing. Now, let's talk about the self isolation aspect of the COVID-19. Over time, health or the frontliners have maintained that people can self isolate at home and all. Now, doesn't that pose a risk in itself? Because, for instance, a person who lives by themselves, they may need other household supplies even during their isolation period. If they go out to the community, wouldn't they be posing a danger or risk to other members of community? And even when they have caregivers, and their caregivers or people who take care of them are also exposed to the virus, because they interact with them on a daily. How isn't this basically a risk? And how can we move away from this, where people have to isolate at home for a period?
Obviously, given the number of cases that we see, not all of them can be treated in the hospital. When you consider, for example, America, with the number of cases that they are having, if they are to put all of them in treatment facilities, I think all the hotels in America will become treatment facilities. They will not have the infrastructure, they will not have the healthcare workers adequately to do that. And so if you are asymptomatic or your symptoms are very mild, you really do not need to come to a facility. But for you to be managed at home, the criteria for home management must be fulfilled. The first criteria should be that at least your case is mild or asymptomatic. The second criteria is the home environment must be conducive. And when we talk of home environment that should be conducive, it means that number one, you must your house must have a room where only you can stay inside, right?
Okay.
Secondly, you must have a toilet to yourself for the period of self-isolation. Thirdly, there must be somebody in the house that can provide support for you. And if these things are not there, it's not possible for you to do self-isolation. So if somebody is living in a 2-bedroom house and they are 10 and 3 of them or 4 are in a room, obviously isolation at home is already out of the question. And to reduce the risk of infection, transmission of the infection in the house, it is recommended that nobody visits that room except the caregiver. So your children or whoever should not be coming to greet you. Isolation is isolation. You just stay in that room. You don't share cutlery and beddings with anybody during the period of that isolation. The person that comes to your room must be properly kitted, wear face mask and all of that, and hand sanitize. The surfaces in your room, they must be wiped frequently with appropriate disinfectants. And the interaction with people should be limited as much as possible. In some places, actually, they can even bring your food, knock on your door, you don't enter you. Even if it's your wife, they open the door, they hand you the food, and they go back. But properly kitted, with face mask and all of that. So if that is done, the risk of transmission is limited. And obviously, even if you are staying at home, you still have hospital support. You are provided the necessary supportive treatments, and somebody comes on a daily basis. At least either come or call to monitor that you are complying with the instructions on the line. Number two, to find out whether you are developing any symptoms or you are stable. And if you are developing symptoms, then they have to review whether to keep you, continue to keep you at home or to take you to isolation treatment centers. So there are protocols even for home management. So it's not just go and stay at home and remove it like that.
Okay, I think, Professor, you're one person who is right to answer this question as an academician and as a frontliner as well. Do you think that it's safe enough for schools to reopen at this time? And if not, what can we do to, make sure that people can go back to school? Because that's one area that's affecting, that's, a source of concern to most parents at the time and even students across Nigeria. School resumption. The federal government is saying schools may not resume on the 18th of January as initially planned. If that's the case, what can we do as a people to make sure that that people go back to school and and also stay safe?
I think we are a country that is not moving with the times. In developed countries, a lot of the schooling is done virtually now. So is it possible, for us to look at the feasibility of doing a lot of virtual schooling? I have not, even the universities, I can't wrap my head around it, How are we going to do lectures in a lecture hall that is holding 1,000 people, say, sitting on the ground by the windowsill, all of that? Have we thought of how to have schooling in such a way that it will not become super spreading centers for COVID-19? I have not heard of the protocols that are being put in place, even for universities to resume. Are we still going back to lecture halls the way they are? How are we going to structure the learning that is going to happen? I have not had that discussion taking place yet. I'm just hearing let us resume. Nobody is talking about platforms for virtual learning. Can we do some of it by Zoom or whatever it is? No such discussion is happening. And the sooner we begin these conversations, the better. So it's not just about go back to school.
Well, the sooner we begin these conversations, the better. The conversations around virtual learning and how we can stay safe even while we're studying. It's quite surprising that after almost a year now since Nigeria recorded its first or its index case of COVID-19, with all the stuff that we've seen advanced countries do, at some point it was reported that China built a hospital facility within 48 hours, and we still have bad internet infrastructure. We still have we're not even looking at moving education virtual. It's quite surprising to a lot of people. Now let's bring you into the conversation. 081 40,000 989. That is 081 40,000 989 and 07087 800 989. 07087 800 989. We're taking calls now. Hello, good morning.
Yeah, good morning, sir.
Good morning. Welcome to Perspectives.
Good morning to yes, the professor.
Good morning. Go ahead.
My name is Mike Baba.
Mike Baba, you have a contribution?
Honestly, it baffles me when people are dying and they are bringing some projects that are, to me, are not useful to Nigeria today. Just like the issue of this rail line, they are talking of establishing a rail line linking Nigeria and Niger. Why people are dying here because of this type of a thing? Why can't they sit down and have a report and put money to the right hand? So I must review that somebody like your guest, you should put their heads together and tell the government the truth so that they can move this nation forward and not be doing eye service, not be bringing projects that are not of any impact to people. Thank you. Have a nice day.
Thank you very much, Mike Baba, for calling. While he's saying, with people dying, the project and the focus of government at this time should have been healthcare and not some of the projects we see. We're still going to take more calls. 081 40,000 989. That is 081 400 00989 and 07087 800 989 07087 800 989. Professor, you see people speak about hospital facilities and how the protocols put in place, social distancing, face mask wearing, and all that are not adequately adhered to, or are not adhered to even at health facilities. We've had complaints of people walking into hospitals, and even the nurses and not protected enough. We see no social distancing at the hospitals. People queue and sit around the hospitals without any form of social distancing being observed. How do you react to that if the pieces that are supposed to cater for people's health are not that safe? Hold on that thought. I'll take this call and then we talk about that. Hello, good morning.
Hello, good morning, Prince.
Good morning. Welcome to Perspectives.
Good morning also to the professor. My name is Comrade Gabriel, the Tezaman. What I wanted to say is that initially the federal government says that other Minister of Health says that some states they want to leave this in the open of schools, they want to leave it to them. And some states, about 3 states, I think they have pronounced that they are going to open their schools. But today, what we heard from the federal government is saying that they are not sure because of the recent development in the COVID-19. So what I wanted to ask is that, is it possible for state, because like Kaduna State Governor now, Manatu Rufai, and in data, for example, they are trying their best to educate us on how to maintain social distance orders in COVID-19. Don't you think some states also should take this measure so that they can be able to go to these facilities and check whether it is possible for them to open their school? Because even the students at home, I'm just telling you the truth. In fact, there's no social distance between the students that are at home at all. They play together, they do everything together. So I don't know how we can be able to cope up these things. And finally, I want to ask the professor, does it mean that this COVID-19 has no cure? If it has no cure, why are we producing vaccine? Thank you.
Thank you very much for your questions. Professor, you got the questions?
Yeah, I got it.
Okay, so please respond to this before we get back to talk about the hospitals.
Okay, thank you very much. The issue of resumption of schools, I'm not an educationist and it's not my primary sector, but I'm sure that government will not just sit down and fold its arms and deny children the opportunity to go to school, noting the priority that Kaduna State government has placed on education. But we want the children to be safe. We want to ensure that, when they go to school, the risk of getting infection is not high. If you are looking at, if you've been following the statistics, for example, the Kaduna State, there has been such an exponential increase in the number of cases. Kaduna State is now one of the top 3 or 4 states. After when you talk of Lagos, you talk of FCT, the next thing you are talking of Kaduna, when before we were at the bottom. So the increase in the number of cases in Kaduna State is quite worrisome. And then when you look at the proportion of the tests that comes out positive across the nation, Kaduna State is number 1. So the problem in Kaduna State now is quite significant. And we need to begin to bring it under control. I want to believe as soon as the situation improves and it is possible for children to go back to school without compromising their safety and their health, the state government will allow the schools to reopen. What was the second question now?
The vaccines and treatment. If there's no cure, why are we paying too much attention to vaccines? And that's what Comrade Gabriel.
So, as you know, COVID-19 is a viral infection, and as with most viral infections, we do not have a definitive cure. For example, HIV, you have drugs that will at least significantly reduce the viral load and allow you to live as long a life as possible. Common cold, we don't even have treatments. Measles, we don't have treatments that can cure it. So the same thing with this coronavirus. But as with other viruses, we also have vaccines that can prevent it and ensure that people don't get infected. We have vaccines against measles that we give to our children. Measles is a viral infection. We have vaccine against polio. Polio is a viral infection. We have vaccine against hepatitis. It's a viral infection. So we can go on and on and on. And prevention, they say, is better than cure. Luckily, with advanced technology, it's impossible to at least develop a vaccine for COVID-19 in the shortest possible time. And the vaccine has been found to be very efficacious. At least it will protect 95% of the people that receive the vaccine from developing the disease. That's one of the vaccines. So the efficacy ranges between 90 and 95%. And if you have something as efficacious as that, and it is coming to the market, if resources are available and access to the vaccine is there, then at least it is another armament that we have to fight the COVID-19. So I don't know what the fears really are. I know there's a lot of misinformation out there, you know, from the religious community, from the general population, all sorts of stories going out there around the vaccines. I recommend that people, as much as possible, try to at least access scientific literature so we can get a better understanding of what these vaccines are all about.
Okay. So
that we can be better informed and take our own independent decisions on the vaccines.
All right. Let's take more calls. 081 40,000 989 and 07087 800 989. Hello, good morning.
Hello, good morning, brother.
Good morning. Ogunwole, welcome. Ogunwole, good to have you.
Thank you very much. Please, about this COVID-19 issue, we all know that it's a virus that nobody can see. About that one, look at our environment first. Those places in Kaduna South here, most of what we are eating the dust, living the dust. Most of 85% in Kaduna South here, most of where also have malaria. Please, I'm appealing to government of this Kaduna State to come and look what to do in Kaduna South. When we are look at the road left and right, it's not hard, and we are saying we are in Kaduna State. Please, they should do the anything to avoid this malaria issue. Bye-bye.
Well, thank you very much, Ogunwole. We're talking COVID-19. But Professor, you may want to respond to that. He says, I think he's talking about the environment and how that can increase the transmission of COVID-19.
I didn't hear the question or the point he was making.
Well, he was referring to the environment, and our environment and how it can, increase the spread or transmission of COVID-19. Saying that the environments are not clean enough. Maybe that can contribute a whole lot to the spread of the virus.
Yeah, environmental sanitation is quite important. Poor environmental sanitation is a risk factor for so many diseases, and which are even deadlier than COVID-19. So it's imperative on us to keep our environment clean. It is also imperative on the government of Kaduna State to ensure that the environmental health units are functional. Refuse dumps are not allowed to at least build up. Refuse is collected, the roads are kept clean, and the environment generally clean. So it is a collective responsibility, both the populace and the government, to ensure a healthy and clean environment, both for aesthetics and for our health.
All right, let's quickly talk about the health facilities and how people have reported that some of them may not even be safe enough for people who go there.
I absolutely agree with you that health workers that should be role models for the general populace, in terms of adherence to COVID-19 protocols, are flaunting the protocols. Kaduna State has one of the response pillars, the infection prevention and control pillar, that has conducted training for health workers on at least ensuring that the health facility environments do not become transmission grounds for COVID-19. So how we limit the risk of transmission of COVID-19 to both patients and the healthcare workers. What protocols need to be put in place? The National Primary Healthcare Development Agency conducted training across the nation for primary healthcare workers. And these things are quite simple. Ensure that before patients enter the health facilities, you take their temperatures. Anybody with a fever is a triage. I kept taken to a separate place. People wash their hands or use hand sanitizer. And the patients or people coming to the facilities should not enter without wearing a face mask. Health workers must wear face masks. Areas where they need to don, they should wear gowns and all of that. So everything has been laid out. There should be a triage area. People coming in, if you have fever, cough, you should be taken to a separate place. And if you are assessed and suspected to have COVID-19, we should have a holding area where you are kept, and then the surveillance people are brought to come and look at you. Samples are taken, or where the facilities are there to do the take samples and all of that, they are done. So all these protocols are there. Unfortunately, they must social distance, arrange the seats in such a way that there's at least 6 feet between patients. But you go to health facilities and you find these things are not really happening. And even some of the health workers, when you ask them, why are you not wearing masks, they'll just laugh. So maybe they are part of the population that still think it doesn't exist, or they are not at risk, or whatever it is. And it's unfortunate that these kind of things are happening, because Kaduna State has one of the highest number of health worker infection rates in the country. Doctors, nurses are all coming down with COVID-19 infection. And the sooner we at least begin to do the right things, the better. Because people are coming to the hospital to get well, not to come and get infected with COVID-19.
Absolutely. People are coming to the hospitals to get well, not to get infected with COVID-19. Professor Clara Ijambi, lecturer with the Department of Community Medicine at Ahmadu Bello University and community physician at Ahmadu Bello University Teaching Hospital, head Surveillance Pillar Kaduna State COVID-19 response team. Thank you very much for sharing thoughts with us this morning.
Thank you very much.
Right, and this is where we will close the program. We apologize. We may not be able to take any further calls. We see the phone lines ringing. But thank you again. This is Perspectives brought to you today by the Kaduna State Ministry of Health. Let's do what we can to stay healthy and stay safe. Wash your hands regularly, observe social distancing, put on your face mask and put it on properly, covering from your nose down to the chin, and that's the best way to wear the face mask. And it's not the chin mask, it is your face mask. So put it on properly, and let us all stay safe in Kaduna State. My name is Iheanacho Prince. Thank you very much for being a part of the program today. Bye for now.